Hi and welcome back. This is the last lecture of this module, so study closure. And this is actually sort of a short lecture. There's not a lot to it, but it is an important topic we have to talk about because we spent a lot of time talking about how to initiate a study, so you also need to know how to close it. So when do you close a study? And the obvious answer is when it's done. So when your enrollment is complete and the retention is complete at your site, so everything's been done. You found the patients you said you would. You've maintained them on study, you got all the data you needed. That's really sort of the obvious situation, right? You're done. You've done everything you said you would. Also, a study might be closed when enrollment goals have been reached for all sites. So, if you say you're going to find 40 patients, and you open the study, and you have 10 on, your sponsor might come to you and say, oh, you know what, we're done. We needed 3,000 patients across the United States, and we found the 3,000 patients. So even though you said you were going to give us 40, we don't need any more, so you're done. So the sponsor might make that determination based on the enrollment across all of the sites. Study can also close prematurely for some reasons that are good and bad. So close prematurely if there are safety concerns. So if participants on the study are experiencing serious adverse events that are intolerable. So in other words, the risk of taking this investigational drug outweighs any potential benefit. If also the study drug has been found to be ineffective. So in a phase 3 study, when the investigational drug is being compared to whatever the gold treatment of standard treatment is at the time, and it's an initial look at the initial analysis of some of the data shows that the study drug is not really working, the sponsor might close that study prematurely. Sometimes the investigational drug just doesn't line up with financial goals. This can happen when one sponsor is purchased by another sponsor. So when pharmaceutical companies purchase each other, sometimes an investigational drug no longer fits in what those overarching financial goals might be. It might be safe, it might be working, but for whatever business reason, the sponsor decides they don't want to pursue it anymore. This is the really bad one. Now, you can't do anything about the first 3 ones, but this is really within your domain. Excuse me. Your study site is non-compliant. So there are significant problems that exist at your site. I don't expect anybody that comes through this program to find themselves in that situation, but the sponsor can say, we're ending the study because you're not following the standards, you're not following the regulations, and you are a risk to us. And the investigator can also decide to close a study. This happens when investigators move, for example. So if you have a private practice with 5 doctors, but only 1 doctor does clinical research, and that investigator retires or moves to another part of the country, that private practice might decide to close that study. So these things can all happen prematurely. But typically, when all goes well, you're closing a study because you've done everything you needed to do. So if you have participants on a study that is closing early, can the patients still remain on the study? Yes or no? And it depends on circumstances. Patients who are actively getting treatment and the trial is prematurely ending, sometimes those participants can stay on if there's clear clinical benefit to the participant individually, and if the risk to benefit ratio remains favorable. In other words, it's still safe and that individual's getting clear clinical benefit, then yes, oftentimes the sponsor will allow them to continue to get the investigational drug. However, the early terminating trial, the trial that's ending prematurely, participants may no longer stay on study if there's no clinical benefit to them, and if the risks have unexpectedly increased. Either of those things happen, then no, those participants will not be allowed to remain on the study. And the sponsor and the PI will talk together about whether participants can stay on or not. And then once a decision is made, this information is communicated to the IRB. These kinds of scenarios will oftentimes happen in clinical trials that are endpoints that are terminal illnesses. So what are the applicable regulations? The ICH GCP guideline does include language that requires, quote, a final trial closeout monitoring report. However, the Code of Federal Regulations does not specifically require a closeout visit or closeout activity. Excuse me. So there are 3 key steps to closing out a trial. The first one is a closeout monitoring visit. So typically it's the monitor or the clinical research associate that's been visiting your site will typically do the closeout monitoring visit. And they're going to look at some specific things when they come for this final visit. The first thing is the study drug. If you still have an investigational drug at your site, they're going to instruct you on what to do with it. Oftentimes it's send it back to the sponsor. It might be dispose of it in a specific way. But if you still have study drug, that needs to be resolved. They're going to want to make sure that you have all of the case report forms that you've completed. Speaking of things you're going to maintain, they're going to look at that master regulatory file that we talked about 2 lectures ago, I think. And they're going to want to make sure that there's no missing documents there. They're going to want to address any extra supplies. And then they're going to talk about a final payment, whatever that final payment is still outstanding. And this is really all that's going to happen at this closeout visit. It's really very predictable, and it shouldn't take very long if everybody's been very diligent in maintaining everything throughout the life of the study. The second step then is the PI submits a final report to the IRB. Remember, one of the things the IRB wants is at least an annual report. Right, so an annual report, this is going to be the final report that goes to the IRB. And then the sponsor sends a final letter to the principal investigator saying that the site is closed and the study is over. And the site has done everything that they have said they would do. So those are really just the 3 steps. I mentioned when we were talking about study budgeting that this is usually the final payment. So what happens if your sponsor just decides that life goes on, things get busy, and no one contacts you about a study closeout visit? You've done everything you need to do, right? There's no more work for you. So why can't you just enjoy this beautiful view, appreciate all the work you've done, and feel very accomplished? Just enjoy the moment. Why should you not do that? The reason you want them to come and have a closeout visit is because if they don't, you still have to report to the IRB at least annually. And this is unnecessary work that you're going to do. And it's going to take some of your time, and it's going to be a pain in the neck because it could be avoided. So you really want them to come and do this closeout visit. Otherwise, you have an obligation to continue to update the IRB about the study, even if nothing's happening. So you're going to maintain records at your site after this closeout visit. And there's going to be some minimum requirements according to Section 312. Part 312, Section 62, excuse me. You're going to keep everything, all these regulatory documents, all your case report forms, all your source documents, all this paper that you've collected, you're going to keep it for a minimum of 2 years after the FDA approves it for sale and distribution. And that's what I mean by the approval date. So a minimum of 2 years, or 2 years after the IND is withdrawn. So either the FDA approves it or the sponsor decides they don't want to pursue it anymore. So 2 years after either of those landmarks, because it'll be one or the other. Here's what happens to most sites. Especially if you do an early phase study, you lose track of when the FDA approves this drug, because it could be 5 years, 7, 10 years down the road, right? That's a long time. And you're going to forget you even did this phase 1 or phase 2 study. Also, and you could find out when it was approved. That is public knowledge, and you could find that on the FDA's website. However, it's very difficult to figure out when an IND was withdrawn, because this is usually not announced when investigational drugs are abandoned and they're no longer being developed. This is really not easy to find. So what most sites do is they just keep records forever. So they will use storage facilities like Iron Mountain to maintain their records, and they'll just keep them indefinitely. So it would be good if you had an SOP at your site that would help you to do that, but you will have to maintain the records for at least 2 years after either of these landmarks happen. You can always check your contract for specific sponsor requirements. So the sponsor is going to say at least 2 years, right? That's a minimum requirement by law, but your sponsor might say in your contract that you're going to keep them for 10 years. So look in your contract to see if there's anything specific your sponsor put in there, because they very well might have. So you can always look at that, and you're going to follow whatever your contract says, or at least 2 years. Here's our reference, good old Karen Wood. Please let me know if you have questions. I'd love to talk to you about this. And if not, I'll still talk to you soon. Take care.